Welcome back. I am Dr. Rich Castellano, and in this video, we are continuing our 7 A's of choosing your best facelift doctor. In the last video, we talked about artistry and authority, and now we are discussing anesthesia. These are the 3 basic categories of anesthesia that you need to know about. Number 1, general anesthesia. Number 2, IV sedation or twilight anesthesia. And number 3, local anesthesia, like at the dentist's office, with or without oral relaxing medicine like Valium. General anesthesia requires an anesthesiologist or an anesthesia provider, and most patients today, they want to avoid general anesthesia for obvious reasons: less risk and less recovery. Nobody wants to be put under or have a breathing tube put in unless they absolutely need it. My patients tell me they're afraid of going under or waking up during the procedure. Patients today are concerned about the risks of memory loss or dementia with too much anesthesia. It is always safer to avoid general anesthesia. IV sedation, known as twilight, it may seem safer than general anesthesia, but you are still getting anesthesia into your vein. IV sedation and twilight require an anesthesiologist or an anesthesia provider, and they require you to have an IV. It is widely recognized that local anesthesia with oral relaxing medicine is absolutely the safest way to perform a facelift. Why don't all doctors do local anesthesia facelifts? It takes time to practice and master the local anesthesia facelift. Sometimes it's the surgeon's preference, and some surgeons want to do a more invasive facelift so that they use the general anesthesia. Bottom line, patients love local anesthesia facelifting. Just watch our live videos on YouTube or Facebook to see for yourself. This keeps you out of surgery centers and out of the hospital. Of course, I recommend local anesthesia facelifts with oral Valium, and it's a safer choice than general anesthesia or IV sedation. The next A in choosing your facelift doctor is the approach, or the technique that the doctor uses, which ranges from full traditional facelift to the mini lift. We have discussed the thread lift in another video. That is a temporary skin-only lift, and it is definitely not a facelift. When we consider which is the best choice, a traditional facelift, a mini lift, or somewhere in between, the real question is, what is your outcome? What do you want in your results, recovery, and investment? The following will help you to clarify. Most of our patients, they do not want a traditional facelift or general anesthesia. Some doctors will remove glands or muscles in the neck to sculpt, and I don't think this is necessary, and I do not recommend this. If you want the most you can achieve under local anesthesia, I recommend the image lift, where I work in the areas in blue you'll see on this diagram. I tighten the muscle, under the skin, and I use an internal laser to remove fat and tighten the skin. Some feel they want a little less than the image lift, or it's easier for their budget. Then we recommend the mid lift, which works in the burgundy or purple areas. We still customize the results, but this gives you a general idea. It's a different space that I work in. Or you can do a mini lift. Not all doctors offer a mini lift because they don't feel the results are good enough, but we have a lot of happy mini lift patients. So how do you know if you're a good candidate for a mini lift? The answer is under your chin. If you don't care under here and you like it when you pull here, then you can be a good candidate for a mini. Or if your brain is thinking, if I do a lift and I still have something here, I'm not going to be happy with that, then a mini lift is not for you. This will help you to narrow down your choices. So let's summarize. People often tell me, Dr. Rich, you're the expert. Why don't you tell me what kind of facelift I need? And I will, but I need to know this information first. Do you want your best results? You choose the image lift. Do you want a little bit less, or you want to spend a little bit less? Choose the mid lift. It still does a great job under the neckline and jawline for your profile. Do you not care so much about the neck results, but you like tightening on your jawline? You can choose the mini lift. Do you want general anesthesia, and are you okay with surgical drains and surgical staples? You can choose a more traditional facelifting technique. Keep in mind that even if you do want to be totally put out, Valium by mouth will make you so relaxed, many patients don't remember their procedure, and they still don't need general anesthesia. Budget, of course, plays a role in facelifting, and this is what the brain usually says about the budget. The brain will say, I have the money, or perhaps it'll say, it's not in my budget, or some people say, I'm going to finance it, or I'm going to find a way to pay for it even if it's not in my budget, or I'm going to do fillers or a lesser treatment until I'm ready. When you understand what our patients are usually thinking, it just makes it a little easier to decide what is right for you. Very good. In choosing your facelift surgeon, we have gone over artistry, authority, anesthesia, and approach. In the next video, we discuss the accessories of facelifting. You won't want to miss this. I'll see you there.